And we'd learnt in early April that the death rate in Lombardy was so high because the Italians had placed symptomatic and asymptomatic people into care homes. I think as soon as I put the phone down to the person who advised me of that, which was my special advisor, who happened to have a brother who was a journalist in Italy, which is how I found out. I phoned our director of public health, our director of adult social care, and said, "Is this what's happening in the UK?" And she said, "Yes. We have 4 care homes in Hammersmith and Fulham, all of them privately operated. The NHS are indeed putting people into the care homes. In the Chiswick care home, we've lost 24 patients. This was in I think the second week in April. In the St Vincent's care home, 2 care workers have died, one of which was only 28. I think the other was in her 70s. And straight away, I said, well, we need to close the care homes. What powers do we have? And we did have powers to close them. But we also had hard powers to close them, but we also had the soft power of persuasion and offering help. And the biggest insight for me was when she said, to be a nurse, it takes 4 years of training. To be a doctor, it takes at least 7, depending on your level of expertise. But to be a care home worker, you can sometimes just have a few hours of training, and at best a few days. And having people dealing with a large number of people dying from during a pandemic, people just simply weren't qualified for. So we quickly began to work out what would we do. We decided to put free PPE into all our care homes, and we weren't sure if we charged them, whether they would use it or not. So we just said, let's just deal with that later. We offered training and gave training. We introduced testing, and we had this amazing director of public health who I think really she really did fly once she knew that she was to act without fear or favour. And she arranged for Charing Cross Hospital to provide PPE, and she arranged a first of its kind testing and tracing system. So we were very quickly testing and tracing all patients, irrespective of whether they showed symptoms. And taking a whole bunch of measures to sort of essentially take control of the care homes way before it really became an issue. And then we were raising this across London.